evidence linking COVID-19 infections to myocarditis in patients.
Myocarditis is simply inflammation of the heart muscle. It occurs in response to infection or to injury. That injury can be from what we call autoimmune diseases, when the body's reacting to a certain invader. It's producing antibodies to attack that invader, and sometimes it gets a little confused. It may actually attack the body itself.
Our bodies respond to COVID-19 by producing antibodies to attack the virus. And in rare cases, when these antibodies attack the heart, the resulting inflammation can start impeding normal heart function, resulting in a slew of symptoms.
If the damage becomes a little more extensive, or in some ways disturbs the nerves, then people can feel it as chest pain. If it gets extensive enough that it disturbs the actual function of the heart, then it can cause shortness of breath because the heart's not functioning in the usual way, and there could be some heart failure. That is, some of the lungs can become congested because the heart's not functioning properly. Most often with myocarditis, these things just heal themselves, and in many cases, people may not have even known they had it. It's only in some rare cases where the damage becomes extensive enough that it actually causes people problems.
There has also been evidence of myocarditis in patients who have received the Pfizer or Moderna mRNA vaccines. And despite being an incredibly rare occurrence, about 1 case per 50,000 patients, according to 2 Israeli studies, myocarditis has been cited by some of the vaccine hesitant as a reason they are holding off.
What we've seen is that this increase in risk seems localized to males somewhere between 18 and 29. And the risk, again, in the very best studies is suggested to be quite low. That the people who are affected are most often affected in a very mild way. It's what we call self-limited.
Federal officials have acknowledged a link between myocarditis and the Pfizer and Moderna vaccines. But experts agree the benefits of vaccines far outweigh any potential harms, especially the harms caused by coronavirus infection. The CDC reports that coronavirus patients have 16 times the risk for developing myocarditis compared to people who are uninfected.
There may be some risks associated with the vaccine, but these are highly effective vaccines in preventing the COVID itself. And that provides a lot of offsetting benefits, both for myocarditis and for the wide range of other things that are prevented as a result of taking the vaccine.